Okay, I'm ready now.
All right. I wanted to circle back with you because I think we talked about I was going to present your case at our tour board conference this morning.
Yes, sir.
And so we were able to review all your images and everything that's been going on with the with medical oncologists and radiologists and the surgeons there. From a surgical perspective, there was pretty unanimous agreement that an operation would not be a good idea moving forward.
Okay.
There was especially the radiologist noted that your ureter, which is the tube connecting your kidney down to your bladder, and even part of the base of the bladder, may be involved in some additional disease that wasn't really appreciated as a first run.
Okay.
And that would be a pretty significant operation. And then, as we spoke about in the office too, just the time between the side reduction and HIPEC with Dr. Levine and the recurrence just sort of tells us that this is not a cancer that's responding to surgical intervention.
Sure. Okay.
We talked about what next steps would look like as far as systemic chemotherapies, and we'll have Dr. Key's team reach out to you to speak about more details. There are more what we call standard of care lines of therapy that, with the neuropathy and the issues with your toes with the irinotecan, I certainly understand why to avoid that moving forward. And then sort of after that line of therapy, the other thing we would think about and talk about would be things like clinical trials. But that logistically can be difficult if you're coming from out of state. So I think Dr. Key's team would be able to circle back more with you about if there are other clinical trials locally or folks that you could talk to about clinical trial options.
Yes, sir.
So that was sort of the long and short of it.
I lost you.
Ask any questions or see if any I can answer for you beyond that.
Bill, you got any questions?
I don't.
Okay.
Clinical trials, we could talk to them about them. You could go back and forth, just like Clint does. He's in a clinical trial.
Right. Well,
yeah, and Dr. Key's team will. I have an email out to him to circle back with you. So, I think it gave me it reinforced my sense that this was not a disease process that a surgery was going to be much help with.
Yeah.
I think we want to be thoughtful about when we use that tool because
I agree. And my thing was when the other doctor who you had called me the other day that I talked to, my whole thing is, if usually you get 5.5 years, if you do everything, and I'm on my third year, should I spend the last 2 years trying to battle something for another year? You know what I'm saying? So I don't, you know what I mean? So
I hear you, and I think that, and I think I mentioned this when you're in the office. Your sort of outlook, and I think your faith and things are really strong tools that you have at your disposal.
Exactly.
The thing that I worry about is that eventually this is going to develop some type of bowel obstruction, whether it involves the small bowel near that area of recurrence or it involves the colon.
Right.
If something like that were to occur, I would just make sure that you seek out somebody to consult with that has some experience in peritoneal surface malignancies. That could be Dr. Levine's team if you wanted to be closer to home, but just make sure that it's not just any sort of Tom, Dick, or Harry that's talking to you about that.
Yeah. No, it wouldn't be that at all. I mean, of course, yes, sir.
Yeah.
We reached out to you guys. We reached out to Dr. Levine. We were definitely trying to make sure that whatever is done right.
Yeah.
And
yeah, exactly.
So and I appreciate everything y'all done. And so you're going to have the other doctor you said is going to reach out. But I thought chemotherapy didn't work for peritoneum.
It works for peritoneal disease. There's some historic reasons why people don't think that that's the case. Largely, it doesn't have a lot of efficacy in appendix cancer, which is sort of peritoneal disease.
Right.
But you don't have appendix cancer. And I have seen peritoneal disease from colorectal cancer respond to chemotherapy many times.
Okay, well, see, we was just getting mixed messages. Everything from South Carolina and North Carolina was saying otherwise. So now you're telling us, so I'm glad to hear that. So it's giving me something more to think about. All right, well, you just have them reach out at their earliest, and then we'll go from there.
For sure. It looks like you have an appointment to see him back in February, too, which looks perfect. But,
Okay.
their team should be reaching out.
Awesome. Hey, thank you so much. And I hope you have a great day. Thanks for all your info. And thanks for everything you've done and everything you're doing.
Oh, my pleasure, my friend. Have a happy holiday.
You too, brother. Thanks.
All right. Bye-bye.
Okay, everybody. So it is what it is. There's nothing else they can really do except for trials, and I'm not going through all that. I don't think I'm gonna. I think this is it, guys and gals. I got about 2 years left, right? Why would I spend those last 2 years fighting for those 2 years? If I got 2 years, I might as well live my best life and have the best time I can. Watch out. Move. Stay. So now I got Leslie Sylvan here. Me and her's about to go get the fuel filter. Me and Royce got all the fuel out of it. I got the part out of it that we need to go get now. Check this fuel out. Now, yesterday, all that golden stuff was on the bottom and the yellow stuff was on the top. Now, I got down to 27 degrees here last night with the real fuel, it said. But anyway, so now I came out this morning and all the darker stuff, the honey stuff, looks like it's on top, or it's moved to top. Anyway, it's kind of funny. But the situation ain't funny, just the way it's coming out is. But and then the part we took off was the fuel filter, and then here's the fuel that was in there from that. So that's that's bad. But anyway, we're getting ready to go get it fixed up. But hey, man, look, this is where we're at. God's in control. So from here on out, basically, God's in control. If he keeps me here longer than 2 years, it's because he wants me here and he needs me here. If not, he might take me up there with him to wait and sing with the angels till Jesus comes back. Either way, I'm happy, guys and gals. So don't be sad. Know that I love y'all. And know that I'm going to be okay. And you better come see him on my cross-country tour. All right. Love you all. God bless everyone.
Hello, y'all. We love you and we love Swampy. Want you around a long time.
God's in control. He's going to keep me here. All right, everybody. We'll see you soon. Have a great day. God bless. Love you all.